Shayna's got a plan, no need to fret. Found a way to help that you won't forget. Doctors lost the answers, but she found the key. Empowering ladies, setting us free. Battling the storm with courage and grace. Shayna's got the wisdom to help you embrace. No more relying on pills they don't know. She's got the strength to help you grow. Feel the power rising inside. Shayna's guidance right by your side. Life's getting brighter step by step. With Shayna's touch, you're gonna prep. Feel the power rising inside. Shayna's guidance right by your side. Life's getting brighter step by step. With Shayna's touch, you're gonna prep. Medicine shelves are emptying out. Finding real strength, that's what it's about. No more prescriptions tying you down. With Shayna's help, you'll wear the crown. Ladies, hear the call, it's time to rise. Shayna lifts the veil, opening eyes. No more shadows breaking your day. With her wisdom, fight pain away. Broken
Finding the
past.
strength deep inside. Shayna Melissa takes us on this ride from suffering to a life so free. Her healing touch should set you free.
The shocking truth about medicine. That's what we're going to talk about today. What's in your food and hidden sources of heavy metals. If you're watching live, drop down below, #live, where you're tuning in from. Thank you for being here and showing up. First, I want to give a very big shout out to Evelyn Geller. It's her birthday today. Hey, Evelyn, happy birthday to you and many more. Woo! She has an upcoming caregivers conference the beginning of next month. So stay tuned for that. And we have some other good news. Let me see. It was Evelyn's birthday today, the caregivers conference. What else do we have? Oh, we have an upcoming Shayna Show next Wednesday. Mark your calendars. It's going to air Wednesday at 1 p.m. EST. There we have it with very special guest Alex Lubarsky. He is the CEO and founder. Yes, so next Wednesday, mark your calendars, 1 p.m. EST, right here, same place, same time. If you haven't already, subscribe to the YouTube, connect, and follow. Alex Lubarsky is the CEO and founder of the Naval Expos. I don't know if you guys remember all of those expos with all the functional medicine practitioners around the entire U.S. So he will be our very special guest next Wednesday on the Shayna Show. But today we're going to talk to you about shocking truths about medicine, what's in your food, and hidden sources of heavy metals that are right in front of your eyes and you probably never thought about. So Evelyn says, love the customized tune. Thank you very, very much, Evelyn. Definitely click that subscribe button. Feel free to share away. What other good news we have coming up? We have so many things. Oh, I love seeing text messages. You guys text me with your great news and how much better you're feeling and how great you're doing. So I'd like to share a couple that I received the past few days. Thank you, Ellen, for acknowledging our customization. Here's a couple testimonials I just received within the past few days. One of them is by a fellow nurse practitioner, Dr. Teresa. Big shout out to you. Thank you, thank you, thank you. She followed me ever since the International Convention for Nurse Practitioners, where I spoke and educated the healthcare pros, the fellow NPs from around the globe, mostly US states, China, Hong Kong and Philippines, Taiwan and Philippines. And she caught my talk about autoimmune diseases and disorders, how to recognize the signs, symptoms, what testing we should do, how to accurately diagnose, treatment options, as well as healthier alternatives. So she said, hey, meeting you both at 2024 AANP was an amazing experience and opportunity. Thank you so very much for sharing your expertise during the AAP conference. She said a lot more, but the personal parts I left out of that. So thank you, Dr. Teresa, fellow nurse practitioner, for following me since that international convention in Nashville a few months ago. Can we drown out the background noise? Okay. Oh, here's another one. I just got this a couple days ago. This was really cool. Thank you, thank you, thank you. Crazy Easter coming. I am loving those gene activators and everything. I just can't wait to tell you the positive changes. Well, girl, you know who you are, Angela, and I can't wait to hear your positive changes. All right, I will see her in the upcoming workshop. Oh, I have some other good news. So I have an award ceremony. I like to be the bearer of good news, right? Every time you turn on the news station, can we mute? Okay. Every time I hear the news, it's usually bad news, right? But I want to shed some light on positivity. So, shout out for the birthday, those positive testimonials, how my clients are doing amazing, that the fellow NPs are learning so much. But also, I have an award ceremony to go to just after this. And I was figuring, like, oh my God, what am I going to wear today? And let me figure out something I've never worn before. So I know people haven't seen me in it. So I figured I'm going to do a dainty pinstripe suit, right? And then I figured, whoa, what top am I going to wear underneath? I don't know if you guys heard of 50 Shades of Gray. So I was whipping out my 50 Shades of Peach to see which one would match my pinstripe suit the best. But then I decided to go with these shoes. So I figured I'd show them off. They're pretty blingy. Big shout out. I had gotten these at Eva's Boutique in Sayville. They're absolutely gorgeous and they're comfortable too. And I only wore them once before in Nashville when I spoke at the Music City Center. So that's some good news. Now we're going to get into some raw truths about things. Oh, so I wanted to share with you good news, but also a little bad news. So, you guys know when you go to the doctor or the facility, the hospital facility, and they make you sign on that digital pad saying, oh, consent to treatment. Guys, please, please, please read that. There's a lot more in there than just consent to treatment. I'm going to show you right here one that I just discovered. Now, this facility, North, well, when you sign consent to treatment, don't just sign that pad. Ask them for the printed version, and it is pages. You are signing a lot more than consent to treatment. With this North system, when you sign up for their EMR, you are acknowledging the fact that they can share your data with Google to target you for Google ads, and they have the right to look at the website you were on before your EMR and for an extended period of time after you cease and desist. So check this out. This is the actual new consent that Northwell system is showing. So if you don't sign the digital consent to treat, the new one, and you ask for the printout, here's some of the words in there. Now, just to give you, set up the scenario for you, I was going to that lady doctor for my annual, and I was slapped with this consent. And I said, well, listen, I don't want to just sign it. I want to read it. Please show me the printout. And this is the printout, part of the printout they gave me. Now, in there, now, if you're going to the GYN, you don't want to consent to photographs and video, do you? That was in this consent. You had to agree with that North system to photographing, video, sharing your genetic information, and unmandated vaccination records with government agencies. Now, we could just show that one more time. If you look at this closely, I crossed out photo and videotaping. And I was told that they will not treat us if we cross off anything on that consent. So, you know what? I was refused to treat it and I left, and I will never go back to that system. If you are going to the GYN and you must sign and consent to video and audio taping, photographing, genetic information shared, and non mandated vaccination records to government agencies. This is non mandated information. Then run, okay? Some of the facilities might let you cross something out. This North system will not let you cross anything out because they will not accept it. So, you know what? Run. So always, please, please, please don't just sign those consent. It's a lot more than just for treatment. There was another facility had a similar consent, and it was also that they can use your genetics. And when they dispose of, say they biopsy you, that you're giving them consent to do whatever and whatever, well, wherever they want to do with that genetic information. So if you go for a biopsy, when you sign that consent, see what is happening to your tissue, okay, and where it's going. Um, there's so much more. And then check this out. I try to eat very healthy. Now, I'm not an angel, right? I love my chocolate and to eat it too. But I try to pick my carbs wisely, right? I'm not going to eat the bread and drink the wine and have the chocolate cake. So I've been trying to eat pretty healthy. Now, organic, right? This might blow your mind. Do you know if you get organic meats, it might still have all the vaccinations? How is that even possible? And if you get organic and you think it's clean, but then you read the origin and it's from China, they have different certifications there with their organic standard. We have no idea what it is and who's certifying them. So, organic in China is not the same quality as organic in the US. And I can go on and on. It would absolutely blow your mind on what you're eating, what's in your foods. Now, another thing is makeup, right? So I went to the makeup store yesterday and I tried to get a cleaner line. Now, some of these cleaner lines, they still have all the heavy metals in them, aluminum, titanium, dioxide, all of this stuff. And even the ones that say they're healthier, if you put them through an app like Think Dirty or an app called Yuka, Yuka, Yucca, it will show you how it will rate how clean it is for you. So you can take a makeup line that you think is better for you. And I scanned it and it came up with 0 out of 100. On the Yucca scale, 100 is great and 0 is bad. And that was a better line that was more expensive. So, guys, it's not just what you put in your body, it's what you put on your body. All of my shampoo that I use, my conditioners, my facial cleansers, my body cleansers, my moisturizers are paraben free. Paraben is a hormone disruptor. Depending on what study you read, it's carcinogenic as well. So keep in mind that it's not just what you put in your body, but on your body as well. Even the sunblocks, right? You put sunblock on to think you're going to reduce your risk of skin cancer, but you know what? There's usually paraben in it, which is linked to cancers. So you put the sunblock on to reduce your risk of cancer, but you're slapping on what's a probable carcinogen all over your largest organ, your skin. So I hope these real truths help enlighten you a little further. I'm not a big fan of those sunblock sprays either because everyone's inhaling that. It's spraying on other people. No, no, no good. Prescription drugs. That's another one, right? You think you're getting a prescription drug, right? Do you guys realize it's the third leading cause of death in the USA? So you go to the doctor to get a prescription medicine that's supposed to help you get better or feel better. It's a third leading cause of death in this country, only after heart disease and cancer. And a lot of the prescription deaths are accidental. They're not people abusing the drugs. These are people that are taking the medications as prescribed by their doctor, but they're even given a too high a dose. They're on other medications that the doctor overlooked interact and the pharmacist overlooked, or they're given other medications by other doctors, specialists, or they go to the ER, or they get hospitalized and their meds get changed up, or they take an over the counter medicine. So, a lot of our prescription drug fatalities are due to patients taking the recommended drug at the recommended dose and the recommended time interval for the recommended duration. Doesn't that scare you? So, it's missed the drug interactions by the doctor, by the pharmacist, and totally overlooked, especially the elders that are in and out of the hospitals. They're going to all different doctors. They're going to the ER, maybe getting a cough medicine. My grandpa was a pharmacist, and when I was little, he passed away of a lethal drug interaction. So I'm not opposed to medications, but they should never be a first resort. Here in the US, we're always looking to just pop the pills first. So I use all the other methods as well. And if I attack the root cause of your problem, it stops the progression from getting worse. The meds usually just treat a symptom, they never usually attack an underlying root cause. But if I can identify and attack the underlying root cause, it stops your progression from getting worse. It reverses it. When it reverses, the symptoms go away. When the symptoms go away from attacking the root cause, then you don't need medications to treat symptoms you don't have. Without the meds, you don't have side effects, interactions, overdoses, and deaths. Wow, what a concept. So I'm not opposed to them for the record, but they are definitely not my first line of treatment. I use a lot of other ways: naturopathy, holistic, functional medicine, integrative medicine, cellular level, genetics, biohacking, ways to activate genes and turn on genetic switches so your own body can produce the good defenses endogenously that it used to. So, again, prescription drugs, please don't hop to them first at all. I help a lot of my clients reduce or eliminate their symptoms while simultaneously reducing or even eliminating their reliance on any prescription or even over the counter meds. So I hope you take caution to that and always look to tack to the root cause. And if you're just on one med for your blood pressure, he adds a second, a third, a fourth, you got to realize it's not really helping. So meds are often masking tape on garden hoses, good for now kind of thing. That's all I want to say about that. What else I want to talk about? Oh, okay. Let me talk about that a little more. So medications, I look at it like this, and then I'll get to the warning signs in our car. Medications to me almost killed me a few times. Compazine they gave me for nausea closed up my throat. An antibiotic they gave me for a UTI threw me into something called rhabdomyolysis or myolysis, however you want to say it, which stopped my kidneys from functioning. One of my vital organs was not functioning that good. So these medications can harm us as well. And my list goes on. Post op from one of my surgeries, they over medicated me with too many pain meds and dilaudid, and I almost never woke up. And I've had some other drug interactions as well. And that's as a healthcare pro. Imagine if I didn't know what was going on to tell the doctor, hey, no more dilaudid. Hey, my throat's closing up from the compazine. So it's important to know these drug interactions are not good for us. These warning signs we get, like that shortness of breath that I was having, like my kidneys not working, they are like those warning signs in your dashboard, right? You know how you have these warning signs in your dashboard and the little light goes on and it says, hello, I need oil, give me oil. That's a warning sign that if you don't address that little problem, you're going to have a much bigger problem, right? If you ignore that oil sign, then you need a whole engine. It costs you a lot more money, a lot more time. So please do not ignore the warning signs in your car. We have warning signs and symptoms in our body. They are like those dashboard warning signs, not to be ignored. So do not ignore the warning signs in your car. And if you don't ignore the warning signs in your car, why would you ignore the warning signs in your body? We cannot get replacement parts that easy. Please don't ignore the warning signs in your body. And I'm going to show you just a few of the warning signs that may indicate you have an autoimmune disorder or something called Hashimoto's hypothyroidism. Hashimoto's is a lot more common than people think. However, most of the doctors are just addressing the hormone and replacing it. They're not realizing it's an autoimmune disorder, and they're not treating the autoimmune disorder. So here's some of the warning signs in your body that are not to be ignored. And a lot of these symptoms could indicate Hashimoto's hypothyroidism or a different autoimmune disorder. So please go to your licensed healthcare provider or reach out to myself. I do private, confidential video visits, consultations, no matter what state or country you're in. So here's some of the warning signs that could be Hashimoto's. And you might have a couple of these or a few of these, and it might be Hashimoto's and or a different autoimmune disorder because there's over 100 of them, and they're my area of expertise. I had Hashimoto's, and this is a lot of the symptoms I had. Hair thinning more so than it should be. You might realize your throat looks a little wider, or you notice a lump in it, like your thyroid gland is enlarged. You're exhausted even though you're sleeping 8, 10, 12 hours. You're ready to take a nap in the middle of the day or go to bed for the night, and it's not even dark out yet. You have pain out of proportion to what you should be. You might have irritable bowel, constipation, diarrhea, nausea, vomiting. You might have dry skin. So you could have the dryness in your intestine causing constipation, the dryness in your skin causing an eczema or psoriasis like rash. You could have the excess weight. You're eating right, you're active, and you're still gaining weight or not able to lose weight, and you don't know what else you can possibly do. You might be cold and putting on 2 layers and nobody else is putting their jacket on, or your significant others in your home walking around in t-shirts and shorts and you're putting on another blanket. Or you could have shortness of breath and chest pain, like palpitations, because your heart might be racing. And these symptoms, like I said, are often Hashimoto's hypothyroidism. A lot of people are diagnosed with an underactive thyroid. They don't realize it's Hashimoto's, and they're not treating their underlying autoimmune disorder. There is really not an other than myself, I don't know of an autoimmune expert you can go to. Most people with thyroid problems go to an endocrinologist who deals with hormones, but they are not experts at autoimmune disorders. So please reach out to myself, take one of my upcoming classes, courses, workshops, or private video visit with me. I have successfully treated Hashimoto's where my clients now don't have these symptoms anymore. And I am one of them. My husband's another. And yet we are not reliant on that prescription medication called levothyroxine or Synthroid. And we feel better not taking it and have more energy. I'm not saying stop any of your medicines. Talk to a licensed healthcare provider, your doctor, or a fellow nurse practitioner. All right, what else we got? Oh my God, we got so much going on today. Oh, there's also in with the prescription drugs that I went into, you also have to be cautious on scans that you go for, right? You go for a CAT scan, it's radiation. You go for a mammography, it's radiation. So it's time for you to reclaim your life. I'm not saying don't go for those tests. Weigh out the pros and cons and talk to your licensed healthcare provider. It's time for you to reclaim your life. We have an upcoming super workshop. I'm very, very excited about it. It's going to be live, interactive, fun, not boring, not monotone. Reclaim your life. There are hundreds of hours this month, and you are worthy. You are deserving to just take 1 hour out of the hundreds this month, a power hour packed with information to reclaim your life. It's live. It's going to be on Zoom. You must register to obtain it. It's going to be Thursday, May 1st, 7 p.m. EST for a Power Hour Live. You can join us free or level up to VIP. We're going to talk all about signs, symptoms, tests, medical mysteries, autoimmune disorders, touch more on Hashimoto's as well as POTS. And the free session is 7 to 8. Thursday, May 1st, 7 p.m. You can scan that barcode or go to worldwellnessexpert.com/reclaim or just worldwellnessexpert.com to claim your free or VIP seat. The free session is 7 to 8. If you level up to VIP, you're going to get the digital and printable Reclaim Your Life workbook with all the notes. You're going to get an extra power hour right after the event for a live Q&A session where you get to ask me all of your questions for up to 1 hour. You know, the typical doctor might give you less than 5 minutes of questions, and you pay just as much waiting there for 2 hours to get less than 5 minutes of answers. This is an hour of live Q&A. And you're also going to get a private mini consultation guidance call or Zoom with me personally at another date and time, all for only $47. So go to worldwellnessexpert.com/reclaim. Either sign up for the free, or when you register, level up to VIP to get the digital printable workbook, the live Q&A session, and a mini consultation with me. What else we got? Oh my God, so much is going on. Heavy there's the website. Heavy metals is everywhere, right? We're not talking heavy metal like Metallica or anything like that. These heavy metals, and even metals that are not heavy, you got tin foil, you got the tins that you put your food in, you got the tin cans, you go for a nuclear stress test, thallium, right? You get a CAT scan with contrast, iohexol, Omnipec. You get an MRI with gadolinium or Omnipec. These are all heavy metals. They are not out of your system in a few days. They are discovered on autopsies years later. So please, if you need a test, great, but weigh the pros and cons and see if you can get imaging without the contrast when needed. Even mammography, yes, has some radiation tied to it. So in Europe, they don't do them annually. They do them every 2 to 3 years. A downside of that is breast cancer you could delay detection of that early detection, and it could have metastasized. So weigh out the pros and cons. Even when you go to the airport and you go through those radar detectors, they are scanning your body. That is radiation. This is no good. A lot of the makeups have titanium and dioxide and all this stuff. What else? Dementia, right? We're seeing so much more dementia and autism. A lot of it is heavy metals. We put fluoride in our toothpaste, in our waters, in the kids' vitamins. Fluoride is tied to a lot of heavy metals. No good. Dementia is now tied to the statin drugs, and so is Parkinson's. The statin drugs deplete your own CoQ10. They lead to early Alzheimer's per some studies and early Parkinson's, and put you at a higher risk for diabetes. And a lot of these statins were not proven as effective as they were once thought, because they reduce the particles. There's different particle sizes of your cholesterol, and there's small particle sizes and large ones, and they reduce the number of particle sizes that are the big ones that are not the problem. They really don't impact and decrease the small particle size cholesterol that really could be impactful in clogging our arteries. We went over organic. China has a different organic. Organic meats can have vaccines in them. Go to your local farmers. Please support your local farmers. They don't put the waxes on them. They're not dipping the bananas probably in those ripening agents and all these other things. Did you know what else can be in your food? Check this out. They have supposedly perfected putting the vaccine, the Rona, in lettuce and tomatoes. And most states have absolutely no law about putting it in there. And they don't even have a law in place that the consumer needs to be aware that it's in their lettuce and their tomato. How insane is that? So the lawmakers are trying to pass laws now that make it illegal, or the consumer has to be aware of this. Yeah, I can go on and on and on. And then they've also experimented with putting the Rona in mosquitoes. So when you get a mosquito bite, it might be giving you little doses. This is insane. A lot of this virus works on the mitochondria in your cells, the energy stations, the powerhouses that are required for the cells to live. And I help activate genes and genetic highways that I can actually make your own body produce more mitochondria that are required for the cells to live. Okay, here, this is really cool. If you guys are redoing your bathroom or your kitchen, right? Say you're redoing your kitchen. We know we're all a big fan of Google, right? Would you rather go to Google and try to find out how to do the demo, how to do the electrical, the plumbing, what equipment to buy, what's up to code in your town? And probably 5 years later, your kitchen will still look like that picture, right? Or would you rather hire a pro, an expert who has done this hundreds or thousands of times and know exactly what to do, where to go, what the requirements are, and how to get that magnificent, beautiful outcome? Right? So you guys can drop in the chat. Would you rather, one, Google to figure out how to do something yourself and still not have it done in 5 years, or save all those years and all that time and energy and worrying and just hire a pro or an expert, right? That's what I did with my own kitchen. I hired the pros to do it. It expedited the journey and it saved me tons of time and worrying and anxiety. So I want to help you expedite your wellness journey. So you don't, I have 30 plus years as a licensed healthcare pro of experience. 5 college degrees, 4 nursing and medical licenses. A lot of what I know up here you will never find on Google. So I want to help expedite your wellness journey. So check this out. We know you'd probably like to hire an expert versus spend 5 years and do a Google research, right? Now, would you rather, if you're going from New York to Cali, would you rather hike, bike, take a vet, or the jet? And drop down below. I would like to hear you. So you're going from New York to Cali. Would you rather walk there? There's no path, no directions, no good roadmap. Would you rather hop on the bicycle? Maybe it's a little bit quicker. Would you rather hop in a vet, right? That can make you go faster. And there's paved roads and maps and GPSs. Or would you rather hop in the jet, right? You're probably there in no time. So I want to help expedite your wellness journey. So instead of walking there and you know what, in 5 years, you're still going in circles and didn't make it to Cali because people are giving you wrong directions because they've never walked there, can't tell you how to get there. Or you rather learn from someone who's been there, done that. I suffered all of these autoimmune symptoms and I was maxed out on meds. I tried that route. I was gaslit by the doctors telling me you're fine, you're getting older, your tests are normal. And I knew I wanted to listen to my own signs and symptoms, my own dashboard lights telling me that something wasn't right. Often our signs and symptoms show years before the tests tell. So I know if you're not feeling right, it's not just a sign of getting older. You can see an 80-year-old dancing with high energy, right? So we know there's more to it. These are often undiagnosed problems, often autoimmune. Only take direction from someone who's been where you want to go, a licensed healthcare pro. I could expedite your journey. So you're not walking there taking years, a bicycle, or even the vet. You're hopping the jet, boom. And in 90 days, you are, you're well on your wellness journey. So I want to help you do that. I unfortunately didn't get through a lot of what I wanted to say today because I have 30 years of knowledge stuck up here. I thank you guys for tuning in. Please drop down below where you're watching from. If you haven't already, connected, like, follow, subscribe to the YouTube at Shayna Melissa. And I hope to see you on the Reclaim Your Life Power Hour Super Workshop that I can help expedite your journey. Use me as that vehicle to expedite your wellness journey from where you are to where you want to be. Because the best way to get from where you are to where you want to be is to look towards someone that's been there, done that, and replicated thousands of times with many, many, many other people and circumstances. So I could expedite that journey for you from New York to Cali. In case you didn't realize, I had all of those symptoms. I was maxed out. I was exhausted no matter how much I slept. I was in excruciating pain. My hair was thinning. I was gaining weight. My sugars, my blood pressure was higher. My kidneys weren't working. I was in heart failure. I was diagnosed with MS. And now, fast forward, I have none of those symptoms, no flare ups in years. I take no medications. I'm happy. I'm energetic. I have thicker head of hair. My heart functions normal. My heart doctor is now my client. I mean, what more can I say? So I want to expedite your journey. Let's just put up that last slide with the Reclaim Your Life website. Oh yeah, like, subscribe, share this. If you got some value of this and you know of someone that's suffering with symptoms and you think they can benefit from my workshop, please click that share button. Send it to their wall, send it to your stories, your group, your business page, your friends. And here, join us. You got nothing to lose. It's free, right? I don't know if I'll ever offer it again for free. And I don't know if I don't think I'll ever offer the VIP this low ever again. So it's live, reclaim your life, power hour, Zoom super workshop from the comfort of your couch. Scan that barcode or just go to worldwellnessexpert.com. Click on the reclaim or worldwellnessexpert.com/reclaim. The choice is yours, free or VIP. If you're like, you can't make the date, level up to VIP because you'll also gain the replay. So the freebie is going to be Thursday, May 1st, 7 to 8, a power hour of gold nuggets on Zoom. Only those registered will have access. I am limiting the number of free and VIP seats as well. So join it now. Mark your calendar. Thursday, May 1st. The free sessions 7 to 8. The VIPs get an additional hour 8 to 9 for a live Q&A. The VIPs also gain replay access if you can't make it. They also gain the digital and printable workbook with all the notes. Any minute consultation with me for $47. I don't think I will ever, ever, ever offer it for under $197 or maybe under $97 ever. So please jump on this. You can't get a doctor's visit for $47. You're getting to ask me all your questions for an hour. If not now, you're probably never going to do this. Okay. You are worthy. You are deserving of this 1 hour. There is hundreds of hours this month. Take the time to treat yourself because you know what? If you don't take care of yourself, who will? Right? So that's all I want to say. Thank you for tuning in. I hope to see you on the Reclaim Workshop at worldwellnessexpert.com/reclaim. I'll see you there. Oh, and I'm going to talk more about Hashimoto's, POTS, and oral GLP-1s. Woohoo. All right, guys. Thank you for tuning in. Be well. Biohack and Ola.
Finding the strength deep inside. Shayna Melissa takes us on this ride from suffering to a life so free. Her healing touch, she'll set you free.